Okay, let's just start with the descending membrane, which is posterior elastic lamella. So basic lamella of the corneal endothelium. So basically, it works as the lamella, basal lamella of the corneal endothelium. Is strong and homogeneous layer, very strong, and bind stroma posteriorly. And thickness varies with the age, as we have already discussed that it thickens as the age progresses. So at birth, it's 3 micrometer and 10 to 12 micrometer at adult. Okay, so descending membrane. So composite collagen type 4 and which is glycoprotein resistant to trauma, chemical agent and pathological process. That's why we see what decimeter seal. And whenever corneal ulcer is trauma goes log off. And in that particular case we can see decimeter seals. So high elastic normally stays tension and crawl. Um, if torn, then we can see decimeter fold too whenever corneal edema is high. Surgical procedure if there is anything gone wrong, you can see that. And regenerate if destroyed. It's and definitely Bowman's layer is not regenerated when it destroyed, but this membrane regenerate when it destroyed. So peripherally in with the solvage line is very important whenever we try to see the angle structure. So basically decimal membrane becomes solvage line with age round wart-like excisions are seen in the posterior periphery called Hasselhandel body. It's very important. It can frequently in MCQs. It's basically Hasselhandel body is you can see Hasselhandel body in which structure of the which layer of the cornea. It's common question, MCQ question. Okay. So Descemet's membrane thickens with age progressively, as well as degenerative processes like congenital epithelial dystrophy can be seen in Descemet's membrane. So Solvay's line, which is what is Solvay's line? It's a internal landmark of the corneal limbus. So Solvay's line is internal landmark of the corneal limbus, anterior limit of the trabecular meshwork. So you can definitely we can say in one scope Solvay's line, the prominent and anterior displacement and posteriorly in embryatoxin case. So iron deposits in the Descemet's membrane. It's called Wilson disease, isn't it? Which what do we call that? Kaiser Fleischer ring. See, Fleischer ring in keratoconus, which is iron deposition at epithelium level, and in case of Wilson disease, Kaiser Fleischer ring, KF ring, right? So KF ring deposits at the level of Descemet membrane. It's common MCQ question. Okay. So applied anatomy of descending membrane is remain intact even in the severe corneal ulcer. That's I have already told you, descemet cells, and maintains the integrity of the eyeball even when the whole stroma is log off, forming descemet cells. That's what I'm talking about. And this descemet fold are seen in corneal edema, especially in post-operative case like cataract surgery goes wrong something. You commonly seen descemet fold very clearly, and I have already shown in slit lamp presentation that how you see Desmond fold with the definitely with the retroillumination. It's very good, and even with the optical section, yes. And Habstri is a tear in the Desmond membrane is seen in congenital cataract. It's another MCQ question. The Habstri is seen in which layer of the cornea? It's common question, okay? And Habstri definitely seen in congenital glaucoma. So corneal guttata of Vox. So corneal guttata is commonly one of the conditions, and we discuss the difference in corneal guttata and oh, what do you call that? I forgot that particular name in the contact lens. Basically, the difference we had definitely talk about that difference in contact lens complications too. So blebs, yeah, I recall it. So called blebs and the corneal guttata difference between blebs and corneal guttata. We usually discuss about that thing in contact lens complications. So which is very important. Corneal guttata drop like guttata. Guttata means itself a drop, isn't it? That's why we always write GTT dot and the name of drop, which means guttata. So guttata means literally drop. Drop like exertions involving the entire posterior surface Descemet's membrane, similar with the Hasselhoff body. So corneal guttata may occur independently or as a part of the early sign of Fuchs dystrophy and rarely affected the vision. But guttata means you're seen in Descemet membrane and there is a lot of things going on. So basically, the more term guttata literally means drop. So coming to endothelium, the single layer and hexagonal cubical cell, it's a single layer that's very important. And polymegathism, what do you mean by polymegathism? Isn't it Tom? Poly and megathism. So basically, gradual increase in shape and the decrease in density occurs with the age. Basically means increase in size, basically not cell. Megathism means size, megathos, and decrease in density. So basically, this is a common rate and common MCQs asked in the question. At birth, this is the 6,000 cells per mm cube, and then it falls 26% in first year and further 26% in 11 year. So rate of slowing down uh, basically stabilizes in mid age, but yes, it commonly decreases with the time, isn't it? So polymegatheism means, can you see this cell, which is basically a larger than other things? Because whenever there is one cell dies, then another cell spreads and take a place of that particular cell which cell is died. Okay, so that's the mechanism. So mitosis may occur in young endothelium and infrequent in adults. So basically, yes, we think that mitosis does not occur in Descemet's membrane in endothelial cell. So endothelial cell attached to the Descemet membrane by hemidesmosomes and lateral to each other by tight junctions. So basically, lateral to each other is tight junction, and with the Descemet membrane is hemidesmosomes, and maintained an effective barrier to the aqueous humor, but not that strong as epithelium. Yes, definitely there is a barrier, but leaky barrier, not a strong barrier like epithelium. So maintains the water balance of in the stroma, which is very crucial. By what mechanism? By active pump mechanism. Endothelium is centrally important. We will talk in physiology chapter. So also maintain the transparency. Yes, without endothelium we cannot think about transparency, because the endothelium pump mechanism is central, crucial, important to make the cornea relative dehydration state, which is 70% approximately. So dysfunction of the endothelium pump leads to corneal edema, and we're definitely going to talk about this whole process, not in that detail, but like physiology faculty. But we are trying to understand what happens if endothelium pump function stops, or endothelium pump function becomes uh, less efficient, then how corneal edema make its path. So we'll definitely talk about it. So applied anatomy of endothelium in keratoconus or diabetic mellitus patient, it's seen that the endothelium morphology changes with a decrease in cell density. So in a keratoconus patient, we always do in our hospital setup that, what do you call it, that speculometry and specular microscopy, and accelerated cell loss obviously infers endothelial dystrophies, definitely, and disrupted on the existence of excessive collagen and produce stress in endothelial cells. So posterior morphology, corneal dystrophy. Endothelial cell displays the characteristics similar to epithelium, multilayer and tonofiliar and multiple microvilli and surface keratin. This is particular conditions, and congenital endothelial dystrophy. This is another condition where we can see the absence of corneal endothelium, which is very bad conditions. So let's talk about a little bit about Duas layer. It was there. Uh, it called 15 micrometer thick between stroma and Descemet's membrane. So by them it's called fourth layer, because first layer epithelium, Bowman's layer, then stroma, then fourth is Duas layer, and contribute to seem like trabecular meshwork in peripheral cornea, and it's very strong layer as far as I know. So that's it for the anatomy, and I have taken this reference, this three book. I think this great book, Wolf Anatomy, is, I think it's very central, important book. So I have taken Eke Khurana also in the reference. So that's it. We will definitely talk about physiology in the next class. So I think that's it. So Bistan, cheers.